Hi there, and welcome to the Bodylife Clinic here in Cavan Town. My name is John O'Reilly, and I'm the CEO here of the Bodylife Clinic. Just the last couple of weeks, we've had quite a number of calls into the clinic from ex-patients that we've had here in the clinic with very good results from our latest new treatment that we have here at the clinic. And it's all down to one gentleman, and his name is Dr. Gehad. And I'd like to just take this opportunity to introduce you to Dr. Gehad personally, and so we put a face behind the phone call. Dr. Gehad, you're very welcome.
Thank you. Thank you so much for having me.
A pleasure. Tell us a little bit about yourself.
Well, I've been doing anesthesia and pain management for the last 30 years in Ireland. And over the last 5 years, I started to use orthobiologic material for pain management instead of the usual steroids and nerve block and other procedure for pain. It's called regenerative medicine, whereby you, instead of treating the pain itself as a symptoms, you just treat the root of the pain, and the pain will be looked after without any interference, without anti-inflammatory, without painkiller. I don't write prescriptions for patients for pain. I just treat them straight away, because I treat the root of the problem rather than the pain itself.
And what are the most kind of common injuries that you would have coming in here to the clinic?
Well, I applied this in the musculoskeletal system, and of course, if you look at the arthritis, is very common in Ireland. So the knee is by far maybe the most common joint to be affected. The back, hips, shoulder, ankle, temporomandibular joints up here, all joints in the body, as well as soft tissue as well, from heel spur, plantar fasciitis, tear of the ligaments. All those soft tissue can be treated with the orthobiologic material.
Sure. And is there an age restriction on the stem cell treatment?
Absolutely not. Anyone can have it. Especially, I've done one lady who's 95 years old, who obviously has a knee problem, and she wouldn't be tolerating the knee replacement surgery at all. It's quite good for people who can't have surgery, or they do not want to have surgery and they have something alternative to that.
And I believe then with the procedure, it's very quick. They just pop into the clinic, do a consultation first to see if they're candidates.
Yeah, first of all, I have to diagnose exactly what's going on, and this is the success of the treatment is heavily dependent on the diagnosis, and then the treatment will be an easy part. It's the patient, there's no need for general anesthetic or hospital admission or downtime as such. So they come in walking and they walk out on the same day. It takes about 1 hour to 2 hours. It depends on what I'm doing. And it's a very well tolerated, and the whole procedure, all in all, is less uncomfortable than a tooth filling.
Sure. Okay.
Yeah.
Well, that's ideal, really, in a situation now that we're in with COVID, so they don't have to be an inpatient.
Exactly.
Which is ideal.
Yes. Yeah.
Perfect.
It's a very non-invasive technique. Instead of having it's not an operation. It is just an injection. But instead of injecting anti-inflammatory or steroid, you inject orthobiologic material that is taken from the patient himself, and then back into him again.
Perfect.
Yeah.
And tell me, you have a clinic also, I believe, in Dublin and Cork.
I do have one in Dublin, one in Cork, and one in Belfast.
Sure.
Yeah.
So really for patients, it's ideal now, situation based being here in Cavan as well.
Yeah.
They don't have to travel
it's
far
quite
as
handy.
well.
It's quite handy.
So you're in the Lake District.
I like it here in Cavan.
Yeah.
Yeah.
So tell me a little bit more about yourself then.
Well, you see, after doing too much of pain management and anesthesia, I thought this is the way to go. This is the future things where you can have treatment on a non-invasive basis, and it gives as much result as surgery. So why should you have surgery instead of having injection? I'm quite happy with the results I have achieved. I do audit for my work every year. I've done nearly about 4,000 joints so far, and the rate of success in the knee, for example, is 93.8%, which is quite high rate compared to surgery, which is having a patient satisfaction rate of only 40%.
Yeah.
So 93% is just very good results.
Yeah, that's phenomenal when you
Yeah.
think of when you're asking, like, say,
Mm.
maybe an elderly patient there to have to go into hospital there and have a hip replacement or a knee replacement. It really is a good option, you
Oh,
know.
fantastic. I mean, I wouldn't put my mother, which is 80 or 90, for a knee replacement surgery. You see, at this stage in their life, their activity is quite limited,
Sure.
and all what they're looking for is a pain relief, good pain relief that can last for a long time, as well as less medications, because the medication has its side effects and can affect their kidney and stomach and the heart. So it is ideal for those type of patients where surgery is too much invasive for them, and they don't tolerate it. That's another thing, as well as they may not be fit to have the surgery in the first place.
Sure.
And this, it can fill a gap for those patients, especially someone who doesn't want to have a metal in his body,
Sure.
a new knee. So what else could we ask for? I mean, people go for surgery for two main reasons: pain and mobility. If we can manage those two, there's no need for surgery then.
Sure.
Yeah.
So it's also ideal there for the likes of the sports person there who really doesn't want to go down the surgery field. They want to get back on the field maybe as quick as possible, you know.
The sports people are difficult to manage because they are so active, they are young, and they're gonna go back to play again. So, and they need to get better within a very short while. Surgery is you see, the player has a short time in the field, so any few months out of their career is significant for any player. So they has to be back at the quickest, as well as to be treated effectively.
Sure.
So yes, it provides a lot of solutions for sports injury, from soft tissue injury to meniscal tear to pain in the cruciate ligament, arthritis, any form of injury that can be treated with the stem cells and orthobiologic.
That's great. Well,
Yeah.
thank you so
Yeah.
much for
No
taking out the
problem
time.
at
I
all.
know
Thank you.
it was a busy day today,
Thank you. It's
and
okay.
thank you for that.
Yeah, thank you.
So you heard it yourself directly there from Dr. Gehad. It's an absolute pleasure and privilege to have him
Please
here
have it.
at the clinic, and we will hope to see you soon. And if you have any problems, just give us a call here at the clinic, at the Bodylife Clinic in Cavan Town, or Cork, Belfast, or even in the city itself in Dublin. Thank you very much. Have a good day.